You actually remember every single moment when you get diagnosed. I mean, I can put myself right back in the office in that situation and hear the words, feel the moment. Grabbed my hands and he said, I have really bad news. You have stage 4 breast cancer. He said, we have to get a biopsy to see if it's still triple negative, but he just looked at me and said, this isn't good. So my husband and I both left in tears.
I grew up with my mom having breast cancer at 40. My grandmother, my great-grandmother on my paternal side all had breast cancer. So for me, it was sort of when, and the question of like, how long do I have until this is going to happen? So I was suggested to get mammograms at 30, and I neglected to do that. But at 32, I found a lump on the left side, and I went in. I realized my nipple was inverted, and I went in and had a biopsy. They put a clip, and everything was fine. So fast forward 1 year later, I ended up finding a lump on the right side. Unfortunately, it was triple negative, and I was completely shuttered. I had a business, I had, a lot of responsibilities. And so being diagnosed at 33, I thought that my whole world had come crumbling down. As I said, I had what I thought was such a wealth of knowledge about breast cancer, having so many people in my family, but I had never heard of triple negative. And I had heard the term red devil before. And when I heard that, that was when I was just like, oh, this is really real. This is not just a joke, or a simple little thing that might go away quickly. So I did Adriamycin Cytoxin. And, I made a lot of lifestyle changes for myself, and being a hairdresser and standing behind the chair, I had to really adjust my lifestyle, my work schedule. And, I remember more so my sort of side effects were like just touching my legs after a day of work felt like I just the tiniest touch, and I just would shudder at that feeling of just fall to the ground and be ready for bed.
Both times I had chemotherapy because at the time there weren't any targeted therapies for triple negative. So I had a really rough time with my stage 1 treatment, which was Taxotere Cytoxin. I had horrible mouth sores. I was just very, very sick with that one. And I ended up having to get 2 dose reductions during that chemotherapy. And then when I had Adriamycin, I didn't end up requiring any dose reductions at the time, but it made me pretty sick. It's a really, really harsh chemotherapy. It was Adriamycin Cytoxin, which is, Adriamycin is known as the red devil. So, and it lives up to its name. So it was really tough. But, at that time, I think when you're metastatic, you're stage 4, it's terminal, it's incurable, I think at that point, you're kind of willing to endure just about anything because it's your life.
The Adriamycin Cytoxin was nasty. I mean, it was just not nice at all. One side effect, just walking out and peeing red was the first shocking thing ever, and I'm like, okay, this is going through me really quickly. And you just think, what else is it hitting that fast? I really tried to combat I didn't have so much diarrhea. I just had constipation from the steroids and from all the medication. And so that was the number one thing for me. And so, I mean, after you're constipated for 7 days, 10 days, I mean, you get angry. So, I mean, you just really want it out of you. So that was a really big struggle for me. Being 33 years old, I think a side effect, I wanted to be normal. And so I really wanted to like put on a happy face and pretend like I could get through this and, that everything was going to be okay. And that was definitely a side effect to my relationships and not being able to really open up and to have the support that I needed from, I had support, but no one really knew exactly what it was like going through it. So feeling very lonely and disconnected from my community at the same time of having them be there. That was really a struggle for me as well.
So when I had the side effects from the Taxotere, I started out with mouth sores. So the mouth sores were my mouth was so tender, and the mouth sores were on my gums. They were on the insides of my mouth. They were on the roof of my mouth, on my tongue, in my throat, and anything, even water, it hurt. It hurt to drink it if it was cold. It hurt to drink it if it was too warm. So I couldn't drink any like coffee, any beverages like that. And even though I was on a soft food diet, everything, it burns, it stings, and it's painful. And when they start going down your throat, then it's not only painful when you're trying to chew food, but it's painful to swallow it. And so you just decide to stop eating and even drinking. And then I developed systemic thrush as a result. I went back and forth between, all kinds of GI symptoms, diarrhea, constipation, and it would just go back and forth. And I lost about 18 pounds in 3 months with that because I couldn't eat. Well, I think when you're dealing with GI side effects and you don't know what to expect, one day you may have horrendous diarrhea and then you may not go at all for another 4 or 5 days. And, so then you're really confused about, okay, I treat the diarrhea and then I have constipation, then I have to treat the constipation, which then flips back to diarrhea. So it's like your days just center around, okay, which do I do? Do I treat for diarrhea today? Do I take the chance that I don't treat for diarrhea because then I don't want to get constipated? And I didn't want to leave the house because I didn't know what to expect. My nose ran constantly. My eyes ran constantly. I was miserable. And I didn't know about dose reductions. So when I went to my oncologist for the 3rd round, I think it was, and he saw how sick I was and how awful my mouth and everything else, was it was just in terrible shape. And he said, we're going to reduce your dose. And it helped a little bit. But by the time I reached my 4th round, which was 3 weeks later, I still wasn't well enough for him to feel comfortable giving me even that dose. So he reduced it another, I think it was 10% or something at the time.
At my 1 year, I had noticed a small sort of bump on my upper shoulder, and I mentioned it to my doctor. And 3 months later, it wasn't gone. It was still there, and it was bigger. I booked a doctor's appointment follow-up, and sure enough, basically the next day I was, getting a scan, and I had the tech basically say to me, well, you're metastatic, so. And I remember laying there in the scanning machine and just lost it. And I said to my doctor, I can't believe the tech would even mutter those words to me. And so sure enough, it was metastatic, and I had another spot on my lung. And, my oncologist sort of said, well, we'll just put you back on ACT. And the knowledge that I do have from my mother and my family is that, many times chemo is what kills people. And I said, hell no, I'm not going back on Adriamycin Cytox. And there's absolutely no way, because how long am I going to have to live? And I'm 34 years old. So I really started like trying to put out feelers and figure out what my options were. So I I had foundation medicine done, and it opened me up. I have a somatic BRCA mutation, and so that opened me up to be on a trial for olaparib. So initially, the side effects were extremely low. I was, maybe I had a couple bouts of diarrhea, but I really tried to control a lot of that stuff with my diet. And I basically had been on it for about 2.5 years until infections. I mean, last year, 2021, I had shingles. I had impetigo. I had, COVID 3 times. I had the amount of infections that I acquired over, I had E. coli twice. So the actual, personal side effects seemed low, but the infections and the susceptibility that I had to everything and anything was just over the moon. So at that time, understanding, so I've been no evidence of disease now for about 18 months. And so once I hit that mark, I said, like in my mind, why wouldn't we titrate or, pull things back? Because I'm well. And, I'm on a trial, so it's very regimented, it's scheduled. And my doctors were like, at first. And each appointment, I kept going back. Okay, I'm ready. Are we going to do this? And so finally, over, I think it had been a year, and they finally, went to the trial and requested a dose reduction. Quality of life and the longevity is the most important things that I'm looking at. Being 38 years old, I want to live as long as possible. And I'm not really interested in having leukemia and having all of these other, comorbidities that develop from medication. So that's the driving force for me asking for a dose reduction, because I am, and I was in a place of success, I should say. And why would I continue to keep poisoning myself while it's done its job at this point?
Well, I think a lot of people don't even realize that they can ask for a dose reduction, or they don't know to go to their oncologist and say, hey, how can we better manage these side effects that I'm having? How can we improve my quality of life? Because I don't want to give up treatment, but at the same time, I'm not having a quality of life with the side effects that I'm having from the treatment. So I think that the thing is you have to self-advocate. You have to be okay with going to your oncologist and saying, we need to talk about this, because it should be a decision between you and your oncologist. And a lot of times our physicians, as good as they are at treating our cancer, they don't necessarily look at the whole person and how our lives are outside of just getting treatment for cancer. So, what is the impact? Are we able to get out of bed during the day? Are we so fatigued? Are we, what are those side effects that are causing us to have such a poor quality of life? So I think the first is just to encourage patients to advocate for themselves. And if they are having side effects that are really destroying their quality of life, they need to have that conversation. And I know many patients that I've talked to, they're afraid to report side effects from their treatment because they're afraid that their oncologist is going to pull them off of this treatment that's working. So they don't want to complain. They don't want to be seen as a whiner or something else. But these are things that your doctor needs to know. I think really at the end of the day, what we're looking at here is personalized medicine. It is getting the right dose, the right drug for the right patient. And we don't all experience the same side effects from a drug decades later. Why are we still pushing for the highest dose possible when we could possibly look at the optimal dose what is the optimal dose? And if that means it's lower, it's still effective, and we're creating fewer toxicities, and patients can stay on the drug longer, they will have better, patients will take the drugs because they're not dealing with severe side effects, then it's a win-win. It's a win-win for oncologists and for patients at the end of the day.